Looking back on it, I just kind of think, why was there this expectation that I was going to physically measure up to healthy people? It's like I feel like my propensity to push myself too much to try and keep up, and also like degrading my health because of that started so young. Just became like a habit that carried through until like my working life as an adult.
Hey there, and welcome to In Sickness and in Health, a podcast about chronic illness, disability, medical traumas, and everyday uncomfortable healthcare experiences. My name is Cara. I'm not a doctor or a medical professional. I'm just a person and a patient who really wants to talk about this stuff more. If you're new to the show, welcome. Nothing said on this show should be considered medical advice. If you're experiencing a medical issue, please seek qualified medical help. I know the system sucks, but I wish you a lot of luck. Every person is different, even within disease groups, so none of my guests should be regarded as official representatives or spokespersons for their conditions. Please respect their very personal choices, and unless they ask for it, please don't make suggestions about treatments or lifestyle changes. As will come up again and again on this show, unsolicited medical advice is almost never not annoying. On this week's episode of the podcast, In Sickness and in Health goes international. I talked to Ariane, an artist, crafter, and holder of a master's degree in health geography from Vancouver, Canada. She has a number of long-term complex symptoms, but has yet to get a meaningful diagnosis. Ariane talks about the challenges she faces in the Canadian health system, trying to find answers to her long-term symptoms, and figuring out how to live life beyond just coping.
I mean, as far as I know, I was pretty healthy until I was about 7. And then I got a stomach flu on a vacation, and that was kind of where things started going downhill. And then, it kind of held for like a decade, and then got worse, and then held for a decade and got worse, and it's kind of gone in like plateaus downward, I guess. And it wasn't until I was about 20 and like my third year away from home in university that I started getting sicker a lot more and a lot worse and having a lot of trouble making it to classes and stuff. And that's when I started like going to the doctor again and kind of saying like something's really not right here. Things are getting worse. And that's like one of the times where like my health tanked a bunch was around 20.
I hope you've been enjoying the show so far. I'm really enjoying hearing from you, so keep your feedback coming. A few episodes back, I joked about doing a show called Poopcast about funny poop stories, and I actually really want to do this as a bonus episode or something. You can contribute by recording and sending me your own hilarious stories, not just about poop, but about all kinds of unexpected bodily excretions. So vomit, blood, urine, snot, they all work. The grosser the better. We all have a good story or two, or 3, or more, and there's no sense in keeping them to yourselves. If you have a smartphone, you can use recording apps to record and email me your stories. I'll have a step-by-step guide on the insicknesspod.com blog that I'll link to in the show notes about how to do this with the built-in Voice Memos app. If you'd like to contribute, you can send your recordings to insicknesspod@gmail.com. You can also help us out by rating and reviewing the show on iTunes. It helps other people find In Sickness and in Health. Like us on Facebook, follow us on Twitter, Tumblr, and Instagram @InSicknessPod. Okay, so this is where I try to explain how the Canadian and American systems of healthcare delivery differ. As Ariane points out in the interview, it's not just that healthcare is funded by the government in Canada. It's a fundamentally different system in many different ways. Both are complicated and both have their advantages and shortcomings. I had this naive idea that I would be able to do this podcast without having to talk about these highly politicized and polarized issues, but it was pretty silly of me to think that I could do a show about healthcare without actually talking about the delivery systems that are failing the patients that I talk to. Forgive me if I don't get this all quite right, but you try explaining this stuff in simple terms. It's not easy. In the United States, healthcare facilities are largely owned and operated by private sector businesses, and pricing for the services, pharmaceuticals, and medical devices needed by patients are set by the private enterprises that administer or sell them. We spend more per capita and more on healthcare as percentage of gross domestic product than any other nation, according to the World Health Organization. And often, somehow, our outcomes are actually worse. I've spent a lot of time reading about and trying to understand the American system in all of its complexities and insufficiencies, but to be honest, I don't think anyone fully understands this stuff. But I will put it this way. Some people have coverage and some people don't. And having insurance coverage does not necessarily mean patients get the care that they need. People who aren't insured generally just don't seek medical attention for financial reasons, or they wind up in emergency departments of community hospitals. Among the people that are covered by health insurance, there's a pretty wide range of what that coverage actually costs, covers, and grants access to. Most plans include cost-sharing measures like deductibles and co-pays on top of steeply rising monthly premiums that are intended to discourage overutilization of healthcare resources. But these costs can be incredibly burdensome for those with chronic health conditions. The Patient Protection and Affordable Care Act, commonly called the Affordable Care Act and colloquially known as Obamacare, aimed to extend coverage to more people and make it more affordable, as well as require insurers to cover certain basics, things like preventative care and birth control. And it also aimed to stop discrimination against people based on pre-existing conditions. While the law has helped a lot of people, including myself, it hasn't quite worked out the way it was supposed to for a number of reasons that I'm not even going to get into here because they require their own separate show. We have many tiers of healthcare coverage and access in the U.S. These include those with no coverage, those with public coverage under Medicare, Medicaid, Children's Health Insurance Program, and the Veterans Administration, publicly subsidized coverage by private insurers through the exchanges established by the Affordable Care Act, unsubsidized private coverage for those who don't get coverage through an employer but make too much to qualify for a subsidy, and private coverage through employers. Different plans have different networks, and lower cost options often restrict access to very limited networks of doctors and hospitals, requiring referrals for everything beyond primary care. For many doctors and clinics that treat rare disease and complex patients, they've stopped taking insurance altogether because they cannot get adequate reimbursement for the added time they need to spend with patients. In contrast, it had been my understanding that Canada had a two-tiered system of publicly funded healthcare and private healthcare that is accessible only to people who have the money to pay for it. But it turns out that's not really true, and Ariane helped clear some of that up for me. Canada is actually only a one-tiered system, mostly. Private care, the way that I had thought of it, is actually kind of illegal. The deal in Canada is that the entire system is public. You are, in theory, supposed to get everything you need publicly, thanks to the Canada Health Act of 1984. In the public system, general practitioners act as gatekeepers to additional care, requiring referrals for specialists and testing. Doctor shortages and long wait times plague the entire system. There are a handful of what they call private clinics to do things like elective colonoscopies for cancer screenings, or where you can get specialist consultations, or say integrative medicine clinics where you can get hour-long consults with MDs who are doing stuff outside of what's covered publicly. The part that's illegal is that you cannot charge patients out of pocket in Canada in a private clinic for something that is available by way of the public system. There are many specialist and general practitioner clinics that are privately owned, but then work and bill through the public system legally. It becomes illegal when patients have to pay the clinic out of pocket rather than the clinic being reimbursed by the public system. There's a lot of controversy around this, and just as in the UK, there's actually a movement among conservatives who want to change the system and privatize medicine, similar to what we have here in the US, I guess. In Canada, they do have insurance systems, which differ from the actual healthcare delivery system. This is the part that's more two-tiered, but that's also an oversimplification. Public insurance covers almost all of the basics: surgery, doctor's visits, tests, etc., anything they consider mandatory. But there are holes in it. It doesn't really cover medications or things like physiotherapy or counseling or dental and vision. And that's where private insurance comes in. It fills some of the holes in what the public system doesn't cover. The problem is when you're poor or you don't have a job that provides private insurance, which many do. But then you can't afford some of the really important things, like medication. There are extra safety nets for this, like in British Columbia, where Ariane lives. They have something called Fair Pharmacare. These programs vary by province, but generally, depending on income, the system steps in and pays for more of your medications that people with money don't get covered. But they pick and choose what's covered, and it ends up leaving some people up shit creek without their meds. In both countries, all of this is complicated by geography, with inadequate resources to meet the needs of high population density in urban areas and underserved populations in rural areas. Both systems don't do a very good job of meeting the needs of complex patients, and both face a fundamental problem with getting necessary care to the people who need it. So there you have it, a quick, oversimplified, totally inadequate primer on the difference between the systems in the United States and Canada. Now take a listen to my interview with Ariane to hear how the system has interfered with her getting the help that she needs.
And yeah, I just struggled my way through university for years. I'd just miss classes when I needed to. I'd leave in the middle of class all the time because my stomach was getting upset. And, by around then, people were starting to have a little bit more awareness around chronic illness. So at least like the doctors at the university clinic were a little bit more supportive.
Mm-hmm.
But I never went to disability services to get something like,
Did it even occur to you to actually do that?
I think I thought about it at one point, and I think I might have even asked someone about it, and they were like, "We're not sure we would accommodate something like this." Because basically, like, one of the big problems I was having was making it through 3-hour exams without leaving to go to the washroom, or being able to eat during the exam too.
Mm-hmm. Which are like not ridiculous accommodations to ask for. Those are pretty easy to work around.
Like today, if I went to university for some reason again, I don't think there would be any problem.
Yeah.
But I still wasn't great at advocating for myself back then, and I really still didn't feel like I deserved any accommodations.
Mm-hmm.
Like, because I didn't think of myself as disabled at all.
Right.
I was only just starting to, like, kind of see the seriousness of coping with life as a chronically ill person.
Mm-hmm.
I was pretty sheltered because I went to university for 8 years before I ever had a real job. Because I never went to school full time. I took like 3 to 4 classes per semester, and I went to school year round to make up for a lighter course load. I guess I never had a function like at regular person capacity during those years because
I'm laughing so hard because I know exactly what you're talking about.
Yeah, I would just book all my classes after like 11 a.m. so that I didn't have to skip them all.
Right.
And after finishing school, it took me a while to find a job. So I was off school for several months, and then when I started working, I took a job that was only 4 days a week, but 9 to 5, and it was so difficult.
Yeah,
it was just like
it's a grueling schedule.
But like it was still like every day I was just so exhausted, like picking up pre-made food on the way home, like eating and crashing and repeat. And after a year and a half of that, I got so sick. I got like this horrible upper respiratory infection that I was on antibiotics for like 8 months. Like my lung capacity was decreased. But like I never really recovered from that.
Yeah. And
like that was, I think, like the big kind of downward shift in my health. And like I've just been kind of going downhill since then. I eventually like switched to a different job that was supposed to be just from home, but of course they got offices like 1 month in. Well, I worked part-time, I worked from home a lot of the time, and it was still just like a constant struggle for me to even do like 30-hour weeks. And I eventually left because I was really burnt out and like not, it was a great bunch of people that I worked with. Like I actually really liked the work environment a lot. But yeah, I was just turning into this kind of like angry, unhappy, sick person.
Yeah.
And I thought, oh, like
I know that person.
I'll leave and I'll freelance and, it'll be a better fit for me. But like when I stopped working, I just crashed so hard and I've never gone back to where I was before that.
Yeah,
and so I
sucks.
spent like the last 3 years basically really, really trying to get better medical care. And try and see if there's anything like to help me do better. And I've only been getting sicker and like not finding any help.
Yeah, that sucks. What are some of the barriers that you've been facing to finding better medical care?
Well, so I'm in Canada. So like our system is a different system, like not just because it's publicly funded.
But everything, it just works fundamentally differently.
Yeah. So like I hear people a lot in the US saying, like, if you don't like your doctor, just go find another one.
Yeah.
Like, don't stop until you find a doctor who you work well with. And you can't really do that here.
Right.
So, like, I only got a GP at the start of this year for the first time since I've lived here. So, like, 17 years. I finally got into this community health clinic who only takes complex patients. So that was a huge barrier, just not even having a GP for years.
And did you not have one because you couldn't get one, or like what was the issue there?
Yeah, partly. So there's a real shortage of them here.
Yeah.
And a lot of them just don't want to deal with patients like me. Like you go in and you have your 7 minutes of allotted time and they say, pick one thing to talk about.
Right.
I was like, so I'm supposed to travel a half an hour each way for every 7-minute topic that I want to discuss. Like, I have too many. Can you book me a longer appointment? And they're like, no, bye.
Yeah.
That was definitely an issue. And then there's also shortages with a lot of specialists, and particularly gastroenterologists are one of the worst shortages here. So, a lot of the specialists I've seen, I've had to wait upwards of 6 months, if not like a year, to get an appointment. And you can't switch doctors easily.
Yeah.
So I saw a gastroenterologist probably 7 or 8 years ago and had a workup, or like a partial workup back then, to screen for IBD. And 3 years ago, I started getting really, really worsened symptoms. And I wanted to go get a second opinion. And it took me 2 years to find a doctor who would even take me for a second opinion. Wow. And like by then my symptoms had changed somewhat. And I'd been on this super restrictive diet that was kind of controlling things. And I went through all the hassles to see this doctor for a second opinion. And he was just like, had judged me from them before I had even walked in. Like I never even got to tell him my symptoms. He really seemed like angry I was there for a second opinion.
Oh, wow.
And he did put me through a bunch of tests, which I hesitated to go through with him even because of his attitude towards me.
Yeah.
But like everyone was telling me, like, you don't want to have to wait 6 more months to go back to your old doctor and get the test done. So just like do it. And I really regret it now because I think it's just screwed up. Like I'm going to have to go back to my old doctor, and I'm hoping like he won't be angry and not want to treat me because I saw someone else.
Yeah.
Because I basically got these tests done. He said, I don't see anything, like, go follow up with your GP. Like, essentially, like, don't come back. And, like, I'm no better than I was before the tests. Like, the test didn't solve anything. So, yeah, it's really difficult, like, trying to get specialists who are good.
Yeah, well, we have that problem in the U.S. too.
Yeah, but it's like you get one chance. It's like the doctor you get, and then you're kind of stuck with them.
That's can't go see a different specialist.
Crazy situation.
Yeah,
like not being able to act. I mean, I remember going over and over again to this doctor who I was considering like trying to get as a GP years ago. I remember going back so many times saying like my throat is still bugging me. My throat is still bugging me after these respiratory infections had happened.
Right.
I was starting to have voice problems. I had this spot in my throat that was hurting all the time. And he would just say, like, oh, I don't see anything. And I was like, yeah, but it's, like, down here. And he was like, the third or fourth time I came in about it, he was finally like, well, the only way you're going to be able to know what's going on is if you go to an ENT. And I was like, okay, send me to an ENT. Oh, my goodness.
Right.
And I finally went there, and she stuck, like, a scope down my nose into my throat. And I had, like, a granuloma on my vocal cord. And, like, even though the granuloma's gone now, I have all the same vocal problems and throat problems and pain and stuff that I had back then. And I don't know if it's because there's some nerve damage or something, but like, did that delay of 8 months or whatever it took me to get sent to the specialist
Right.
make me have a worse long-term extra health issue?
Yeah. That's a really good point. Yeah.
It's been like 3 years since my GI stuff got, and like, I definitely think I have IBS because I've had it for 30 years. That's pretty predictable. But like, I started having like, I don't know how detailed and graphic you want me to get here.
Oh, get as
but,
graphic as you want.
I started kind of out of the blue having like violently severe rectal pain and like, a lot of the other symptoms you get with colitis, like basically like I was having a lot of diarrhea, mucus, like some bleeding sometimes. And it's been 3 years I've been trying to get help for that.
Right.
By the time I had a colonoscopy a couple months ago, finally, I had been eating only chicken and rice pretty much for like 2 years.
Yeah, wow.
It suppresses the symptoms. And like, so I hadn't been having these crazy like flares where I have like 10 seconds to get into the bathroom and I'm practically passing out from pain.
Yeah.
But it's because I'm not eating vegetables. Like, and I can't eat vegetables or else I'm like going to end up in the ER for the fourth time this year, you know?
Yeah.
And it's
Yeah,
like,
and if that is
how
something...
am I supposed to get help with that? Like, do I have to make myself violently ill to the point where I'm non-functional and ending up in the ER so that I can actually get someone to take it seriously and evaluate and figure out what's going on?
Right. Yeah. And something like that, which like might actually be inflammatory bowel disease, that's an autoimmune condition. And the longer that the most successful outcomes generally with autoimmune conditions are ones where, they catch it early and they're able to, keep you in remission for as long as possible instead of, allowing those lesions to progress. And
that's the thing is like I started having other symptoms at the same time, like totally different symptoms, but at the same time as that started, I started having a lot of mucous membrane dryness. So like now I have like this sort of tentative possible diagnosis of Sjogren's syndrome, which is an autoimmune disease. But we don't know if it's that or it's like part of this like chronic fatigue syndrome, like which I think is like some kind of dysautonomia thing, though not necessarily POTS. But like I've been reading about a lot of that because my rheumatologist kind of said maybe chronic fatigue, and so I've been learning more about like the physiology behind that to try and make sense of what she was saying.
Yeah.
At first I was like, oh gosh, not another like just chronic fatigue on me, but like, but yeah, I've been learning about like the physiology like of the newer research for around chronic fatigue, and I'm like, sure, maybe it is that like my nervous system is totally wackadoodle and it's not regulating my mucus production properly or whatever, but like a bunch of weird stuff started happening, more severe stuff all at the same time 3 years ago, and I didn't even get a chance to explain that to this GI doctor that I saw.
Yeah.
It's just maddening.
Yeah.
Yeah, and I mean, I've had other things come up that I'm like, this is serious too, because like I got diagnosed with osteoporosis last year.
Oh, wow. Okay.
What's that about? That's not normal when you're 35.
No, but I mean, if you're subsisting on chicken and rice, you're not getting a lot of the nutrients that you need.
But like, that's not an IBS symptom, right?
Right.
It's not a chronic fatigue syndrome.
Yeah.
So I think something else is going on here, and like my GP cares, but like is so overwhelmed with me, frankly. She just like gives me referrals and like tries to like be supportive, but really like none of my doctors are trying to get to the root of what's going on, and it's me pushing this boulder ahead and like not getting anywhere. And like I'm getting at the point now where I'm just like, okay, I'm just going to adapt to this totally lower quality of life, and I'll try and keep working to find answers, but like at some point I just have to figure out how to have a life like this. Yeah,
for sure. I mean, ideally, you can do both at the same time, but you don't always have spoons for that. So, if quality of life is your priority, I think it's a good thing to focus on for sure, especially because my history is very, very similar to yours, and I have all of these really complex symptoms that overlap, I have diagnoses, but it's still really hard to tease out what's what because so many of them have kind of overlapping symptoms. And I have access to pretty good doctors who spend more time with me than most doctors would, and who try a lot harder than a lot of doctors that I've seen in the past, and we still like don't really know what to do and are kind of just like feeling around in the dark, because the things that I wound up being diagnosed with are, there's not been enough research and no one really understands them, and I know way more about them than the doctors do, which is a little challenging.
And it's like, well, at some point you just have to figure out, like, okay, like, how am I going to be a person in this situation? I mean, like, the episode you had a couple back, I think this number 6, the other person who had EDS and dysautonomia.
Yeah, that was episode 6.
You were talking a lot about, like, coming to, I guess, label yourself or not with the word disability. Mm-hmm. And I've been thinking about that so much lately, because I basically feel like I don't see any situation where I'm going to get a lot better.
Right.
Like, especially unless I spend, thousands and thousands of dollars to try and go to the U.S. and get, like, more evaluation.
I wouldn't recommend it. I honestly
and you see people do that and, like, nothing comes out of it. Right?
Right. Well, yeah, I mean, I went to these ridiculous lengths to finally get a diagnosis, but that doesn't, when you get diagnosed with something that doesn't really have any treatments or cures,
exactly.
like, no, and don't get me wrong, finding my diagnosis has been really monumental for me, both, physically, but also especially emotionally and mentally, just finally knowing that, like, I wasn't making this up and that this is all real, that's helpful.
And I mean, just also, like, accepting it for yourself. You were talking about the internalized ableism, and at some point, one of you said something about mobility devices, and, like, oh my gosh, I could go to a museum again.
Yeah.
And I've been practically housebound for the last year, and, like, even people I know who know that I'm unwell don't really get, like, what level that's at.
Yeah.
Like, I don't go out. I don't do stuff anymore unless it's in my house or, like, walking halfway up the block.
Right. Yeah.
I only go for doctor's appointments, and they're exhausting. And I rarely have people over the house because it's exhausting.
Yeah, absolutely. I go out for doctor's appointments and Gatorade.
Yeah, exactly.
And that's it.
Yeah, like, I need to pick up another 6-pack of electrolytes.
Yeah. Yeah. I had a doctor's appointment today that, like, round trip should be like 45 minutes, but I got lost on the way there, and then there was like crazy traffic on the way back. And as if a doctor's appointment wasn't, like, exhausting enough, I just felt so wiped out when I got home. I had to also sit in the waiting room, and then also was a gynecology appointment, so there's, changing of clothes involved and a pelvic exam, which is pretty,
yeah, those are also just, like, tiring. Like, anything that kind of stimulates your nervous system, I find is just, I need a day to recover from it.
Right, and all of these things I haven't, aren't even the interaction between me and the doctor. Which is supposed to be the most important part, but by the time I get to that part, a lot of times I'm just like, just do the thing. I need to go home and go to sleep.
Yeah, and I find a lot, I mean, I've been slowly finding some good specialists, so at least I feel like the appointments aren't a waste.
Yeah, which
is I went
really
to this
important.
horribly long, painful appointment at this pelvic pain clinic a while back, and I had really, like, high hopes for it because I had seen one of the doctors, like, 10 years ago, and I'd had a good experience, and it was just so bad on so many levels. I was there for, like, 3 hours, and
that's such a long time.
So long for me, and it was such a painful exam. And the doctor I was expecting to see wasn't the one who saw me, and the one who I did see was, like, so manic, cutting me off all the time, like, just really not keeping a person relaxed in a situation where you want to be relaxed.
Yeah,
and then at the end, they, like, offered me, to go through their, like, clinic thing that they do with people, But then I told them, like, I can't come to the clinic for an entire day for like my intake, which is the way they're structured.
Oh, wow.
And they basically were telling me, like, well, then we can't give you care. And it was like probably the most traumatic experience I've had. And it's the only time I've done this, but I like walked out into the hallway and just started sobbing. And they had me talk to the doctor, like the lead doctor who I was actually supposed to be seeing then again. And, you know, I expected her to really be sympathetic.
Yeah.
And instead she wasn't. And she phoned me a couple of weeks later to follow up on like whether I was going to participate and stuff like that. And she's just like, so you were a bit anxious. And I was just like, no. Like, yeah, because anxiety is like written in my file.
Right.
Do you not understand like the level of grief I was experiencing when you know, someone finally offered me some medical care and then said I was too sick to access it?
Yeah.
You know, I just like lost it and I was like, no one is ever going to help me.
Yeah. I had a moment like that. Was last year in like April, I think, and I was diagnosed with POTS, but not yet diagnosed with EDS or like most of the other stuff. And I had just been diagnosed with POTS in January, so it was still a really fairly new diagnosis. You know, I was still learning about it, and like I knew enough about it at that point to say like, okay, there's something causing this and all of this other stuff. We should figure out what it is. You know, and so the neurologist that I had been seeing, who is wonderful and who I continue to see to this day, had never heard of POTS before, but I heard that this other doctor had, and I thought, well, you know, what's the harm in going to see a doctor who has actually heard of what I have before, you know? And so, like, at first she brought me into her office, and from the moment we sat down, it went south. And to be fair to the both of us, I think we were both having a really bad day, but just in trying to like communicate what I was experiencing and her trying to receive that communication, there was just like, she was immediately kind of on guard and like on the offensive. I don't know. It was just a very weird kind of vibe for the conversation. And so I was trying to explain what I was experiencing, and she kept interrupting me and trying to change what I was saying. Like, you know, like, and not translate it into medical terms, but just kind of telling me that some of what I was experiencing, you know, wasn't really possible and it must be this other thing. And I'm like, no, that's not what I'm saying. So there was a lot of that kind of back and forth, and I was exhausted. And I think I had been waiting for a really long time too. And so I started to get kind of exasperated. And she was saying that, like, I can't start treating you until you go to the Mayo Clinic and get a full autonomic workup and, you know, whatever, which, you know, even if those possibly hundreds of thousands of dollars worth of tests were to be 100% covered by insurance, which they would not be, the travel there and lodging there is also really expensive and not covered in any way. And also, at that point, I was so sick. I could not get on a plane and fly anywhere.
Yeah, it's like unthinkable, isn't it?
Yeah, I couldn't be in the car for more than half an hour. And she's telling me, you need to go to Minnesota. I live in New York. You need to go to Minnesota to have these people work you up. Yeah. And then maybe I'll start treating you. And so after all of these years of being told by doctors, you know, there's nothing wrong with you, I can't help you, here was a doctor kind of saying to me, like, there's too much wrong with you, I can't help you. Yeah. Like, that was what I was hearing from her. And that's not necessarily what she was saying. She was saying, you know, you're a very complex patient. I don't feel comfortable prescribing anything until we figure out exactly what's going on here. And I appreciate that. That's actually nice, but the way that she said it was not great.
Yeah, and it's hard. I mean, what if that's not an option for you, right? Like, can you not access any care then?
Exactly. You know, I mean, I was lucky in that I could just go back to see the one that I already had and liked. but that was really traumatic, you know, having, because in a matter of 3 months, had gone from having, quote, nothing wrong with me to too much wrong with me.
Right, right.
And, you know, here's this woman who's supposed to know about this thing that I have that no one else knows about, you know, and she's telling me, I cannot and I will not help you. And
Yeah,
I
it's
lost
just
it.
crushing.
Yeah, I didn't even go out into the hallway. I lost it in her office, and I started crying
I
hysterically.
wish I had done that in the doctor's office.
Oh
'Cause I was like,
no,
I was
it was not good.
well, I ended up sobbing in front of the doctor anyway, but it was like
Yeah,
while I was like dealing with the administrative assistants because they were the
yeah,
ones who were like, "Oh, we can't book you because you can't come all day," like, and yeah, they didn't really know what to do with me.
yeah.
They kept going back to talk to the doctor because they had initially said, "Oh, well, we'll figure out how to make it work with you," and then suddenly it was like, "Oh no, we can't do that."
Oh yeah.
And like to their credit, weeks later when I got the phone call, they were like, okay, we think we're gonna like, bend the rules for you a bit, and if you cancel X number of times, then we'll let you go on to see our physiotherapist and counselor without doing the day long intro thing. And it was just like it had become so patronizing by that point. I just
Mhm.
postponed it like indefinitely.
Yeah.
Because basically, like, it was a couple services that I can get privately, plus, like, their main workshop was like a day of stuff on mindfulness
Oh, how
and
helpful.
CBT. And,
Which, to
like,
be fair, those things are actually very helpful, but
they
like
are, but, like,
not
I've
when
also been
you're,
at that for years
yeah,
already.
exactly.
And I was just like, this whole experience has been so bad for me. Like, if I
Yeah,
need to go do pelvic physio, I'll just go pay my $100 an hour somewhere. Like,
right,
and that's for someone who's not been able to work in 3 years.
right. Yeah.
But it's like it's worth that to me,
And
just not to be
especially,
treated like that.
yeah, and
Not
especially for something like a pelvic pain clinic. Like I have this fantasy that like all gynecological clinics should be like the women's center at my college where there's like
right.
couches and everyone's really chill and there's just bowls of condoms everywhere and people can like come out and like hang out and just talk about issues that we're having, and then
Yeah,
there's like
and there's
cool
places like
doctors
that,
and
and then it's like the contrast.
yeah, I have not found any place that exists like that, but it would be
Oh,
lovely
there's
if
this
it did.
wonderful place here. It's called the Women's Health Collective,
Hmm.
and it's like an outreach branch of the Women's Hospital. And it's in the downtown east side, so it's like where there's a lot of people who have trouble accessing healthcare, who
Hmm.
like don't have money, so they have other services included in it. But like it's all nurse practitioners.
Okay.
There's not even any doctors there, and they're wonderful. It's like one of the best health services I've
Nice.
ever dealt with. But like, yeah, I'm like, oh, this is how it should always be. Like, really
Right.
non-judgmental, really
Puts you at ease.
supportive. You
Yeah,
know,
because there's so much stigma around that stuff, and they're like women are. I mean, I don't know how it is in Canada, but here in the U.S., women are so uncomfortable about their vaginas and their uteruses and their periods and all of the stuff that comes with having all of that stuff.
oh, I live in
Um,
like the hippiest, most progressive neighborhood in the city, so I think I have a bit of a skewed perception.
Yeah. I mean, I definitely have a skewed perception too. One of my best friends growing up, her mom was our high school sex ed teacher. So like I'm super comfortable with this stuff and like, it really bums me out that so many women aren't and we aren't like we don't get good information, be it from our parents or from our schools or any other
Right.
like public health initiative. There's just not enough good information getting out there. And so there's a lot of misconceptions, there's a lot of misunderstanding, and there's just a lot of like not thinking about it at all, which isn't particularly helpful either. And so I would love to see more like really inclusive and welcoming kind of women's healthcare out there,
Yeah.
and Planned Parenthood like kind of does that, but
Right.
there's
Right.
the resources are so taxed and like they're under constant attack from like all sorts of angles that like doesn't quite do what I wish it could.
Yeah. Yeah, and I mean, it's funny because you occasionally see women's health clinics that are really functional and good like that, and I keep wishing there was something like that for chronic illness.
Yes.
And like
Also that.
there is like there's a program that's opened up here. It's called like the Complex Chronic Illness Clinic. It's mainly for fibromyalgia, I think chronic fatigue and Lyme disease.
Interesting.
But like the wonderful doctor who they had gotten to move here to head it like left because of controversy and problems and things. And like the wait list is I think 3 years long or something now.
Yeah.
And they're really under resourced. And like I think it's a similar thing where you end up doing like CBT and mindfulness and pacing training, and it's like for someone who's been at it for a while it's still kind of basic.
Right. Yeah.
But like yeah, I just there's so many women our age especially, like it's actually kind of shocking who in their late 20s to early 30s have just gotten like totally knocked out of normal life from chronic illness or mental illness or both, and they're not able to get good health care.
Yeah.
And like they just have to stop working, like if they don't have a partner to depend on, they're really struggling financially. Like I don't think things need to be as bad as they are.
No,
like I know that a lot of us like aren't diagnosable, or maybe there's no treatments for us or whatever, but like I really think that a lot of us could be doing a lot better.
Yeah, I think that supportive healthcare is something that could be really helpful for complex patients, and this is something that I've been really struggling with the past couple weeks, especially of just like total burnout from having to deal with all this stuff constantly and advocate for myself so hard and make sure that I'm getting the care that I need to get. But if I had, something that was...
Or an advocate, right? Like, have you heard of these health advocates that are cropping up here?
I've heard of them. I don't know anyone who's actually, utilized one, and I'm not sure... the other thing that I've been struggling with is that I now know too much. I know too much about my diseases. I know too much about the system. I know too much about how doctors are educated that, I kind of am in a pretty dark place right now where I feel like the health system at every single level is completely unequipped to deal with a patient like me.
Yeah, I did a consultation, just like an intro talk with a private health advocate, which is like the first one I've ever heard of here. And that's kind of how I was left feeling. I was like, she's really nice, really empathetic, but like I don't actually think she can do anything more for me than I'm doing for myself.
Right.
And yet I do feel super like burnt out and super alone making all these decisions about like what to do and what to try. And, I've kind of like finally just taking a bit of a step back to like deal with some other aspects of my life right now.
Right.
But like, even just taking a month off from like full on healthcare mode, I already am realizing like I can't take time off from it because like issues 1, 2, 3, 4, and 6 are like all flaring up right now, and I need to get my specialist appointment referrals in because it's going to take 6 months to see them.
Right.
It's it's I don't know. It is like people say it's a full-time job, and it's it really is. And I wish there was somebody who was helping me manage all this. Because like you kind of hope your GP could do that, but they just don't have the resources.
Yeah, and I finally found a wonderful GP. She was awesome. She knew so much about EDS, and she would admit herself that she's by no means an expert, but she knew 90% more than most general practitioners in the US probably. Knew so much about EDS, knew about the secondary conditions. She had multiple patients just like me.
Wow.
Yeah, exactly. And it gets better. I actually see most of my doctors at a multi-specialty practice. So she
it's
happened...
like a dream world.
Yeah. And then a month and a half later, she left the practice.
No.
Can you believe that?
Why?
Are you serious? No, maybe not a month and a half. It actually might have been maybe 3 or 4 months. But even in that time, I saw her more times and got more out of those visits with her than I did in the 3 years with my previous GP, who like I only saw her for physicals and that was it. And I finally felt like, okay, here's somebody that I can work with that can help me manage this stuff and can help me, feel like if something goes wrong, we at least have a plan, or I at least have somebody to call, Now I'm back to feeling like, yeah, I can call one of the other internal medicine people in that practice, but like, they don't know me, and they might have my electronic health record, but they don't know who I am, and they don't know, how much I know, and they don't, and they certainly don't know as much about EDS as she did, which is frustrating. So,
did you find like, did your GP also help with things like the one great thing mine did was like ask me if I had applied for disability, which I hadn't and had all these feelings about. But like when I started reading up about it, I was like, oh man, I really, really need to do this, like if not for my long-term security.
Yeah.
But like I'm starting to think about broaching the topic of like mobility aids. Mm-hmm. And like, is that something that doctors brought up with you at all?
Oh, no, by no means. And none of them, all of them have tried to avoid talking about disability with me. It was my financial advisor who actually told me I need to apply, because he was like, you're out of options. You've worked full time, and that definitely didn't work. Yeah. You've worked part-time and that didn't work, and you've been freelancing and that's not working. Like you're out of options and you're about to be out of money. So, it's time, and I haven't started. And that was probably a month and a half ago that he told me that. I did try to talk about it with a few of my doctors, and they were all kind of like, well, good luck with all that. They didn't want to have anything to do with it because I am still so young. And I do this really stupid thing when I go see most of my doctors, which is that I pretend I'm doing a lot better than I am. I'm not sure why I do that.
It's such a tough call too, because like some of them react better if you seem put together, and some are just like,
right,
why are you here?
Yeah, because it's a combination of things. There's the internalized ableism where I want to pretend like I'm not as like broken as I am. Mm-hmm. Then there's the fact that I do know that they know they can't help me. Basically, there's things that they can do to help, but essentially they can't really help me. And I know that they know that, and I feel bad about it. Yeah. So I want to make them feel like they're helping me, which is not helpful for either of us. So, what they've been seeing isn't necessarily what my reality has been. And also I can do the song and dance of like, I'm uncomfortable with the situation, so I crack a lot of jokes, and I'm kind of like on during a lot of my doctor's appointments.
I feel you there.
And that is the 10 minutes in my day that I'm on. The rest of the time, like I feel terrible.
Yeah. Yeah, I have trouble with the same thing, and I've been really like, because so I shockingly, like, I think because I had such support from my GP, I was approved for disability like immediately.
That's amazing. Yeah.
Yeah, I was like, what?
Because it's like, at least, I don't know what the process is like in Canada, but here in the US, it's really hard. And most people get denied 2, 3, 4 times.
What I had heard here also, especially because it was for like long term. I guess that's the equivalent in the US. Yeah, so I was like just really shocked, and I was like, oh, it was also kind of like sad for me, because I was like, oh wow, even the government like believes I'm really, really messed up.
Yeah, there's definitely an emotional component to that.
When you fill out the forms and see it all at once, like you have to list all of the things that you cannot do. Mm-hmm. It's really
That's part of the reason I've been putting off the application too, is that like I think one day I sat down and tried to do it, and I was like, fuck this, I'm not doing this today.
Yeah, and it's like, and it took me weeks to fill out too, because it's so much, and you have to write it by hand. Like, I have such bad arthritis, like hand pain right now, which I've also had for the last few years. Like,
That's hilarious,
I could only fill out like 1 page per day.
An inaccessible disability form.
Yeah.
Good job, Canada.
But like, yeah, it's weird. I was so glad, and like I'm really glad it exists. But then it's this is an expensive city. Like, I'm sure, with living in New York, like Vancouver's super expensive. And like, it's just so little money. Like, I'm already so lucky that I'm in a pretty good situation financially. Like, my partner has had good jobs, and like, you know, it could be so much worse. But long term, I don't know how this is supposed to work. So I'm like already hatching like plan Z of like, how am I going to get back to being able to work part time?
Yeah, well, you have launched Plan Z, have you not?
Yeah, yeah. Well, I mean, it's not a business yet, technically. I
Yes.
mean, technically it's a business, but
Yeah.
like we have no income.
Well, I mean, just look at Twitter. They've never been
Yeah.
profitable.
And so, like with disability, like you have an allowable income you can make while on disability. And basically, like once I hit that, then I'll be off of it. And you have a certain number of years where you can be like quickly put back on it if it turns out that you're not actually able to work. Like when you try to work and it's like, oh no, this is actually not doable. But like, yeah, so we've been trying to get this, like, I don't know how much I should explain it, but just like, it's a website for people to do crafting, basically.
Ariane is very modest about Textilia, the platform that she's built with her partner Bruno, which is an online database and community for all manner of sewing and fabric enthusiasts. The platform is a community for quilters, garment, accessory, and home decor sewists, and textile artists such as embroiderers, dyers, and people who print fabric. They can create a profile page to show who they are, what they do, and what they make. There's a discussion forum to talk about tools and techniques, ask for help, and find other local sewists or those with shared interests. They can create a business page to sell their wares and check out featured content. It's a really cool community, and their social media posts are really making me want to break out the old sewing machine.
I'm hoping to be able to work on that part time, but it's so hard because my hands hurt so much. So it's like I'm thinking really hard about like which parts of my body that are busted are causing me like the most struggle and like the most decreased quality of life. And so I've kind of like narrowed it down to three things, and that's what I'm going to focus on to get help with now, because I've been like trying to get kind of everything diagnosed and like spreading myself maybe too thin. So like, I'm going to keep chasing this GI stuff and the chronic fatigue, if there's anything to be done about that, I don't know. And then the hand pain, because like the hand pain is the really big thing that restricts my ability to work from home. Because like I used to work in web development, so like I can do a job that I don't have to leave the house to do, but my hands are killing me every day.
Yeah.
It's like I get to the end of the day and I can't cut my food and I can't squeeze my toothpaste.
Right.
Like that's a problem.
Yeah, that definitely is a problem.
So like it's a matter of like going back to the rheumatologist again and saying like, okay, we evaluated this stuff, but my hand pain is really bad. Like, can we try and figure out what's going on there?
Right. And that's a good strategy to like, when you do have so much stuff going on, just be like, here's what's going on, but let's focus on this thing. And if you can just try to make things like, if you make one thing, 1% better, and you make another thing 1% better, and you like try and, make things better in tiny increments, that can actually be really helpful. That has worked for me in the past, but right now I'm in a big garbage dump. So I don't know how I'm going to get out of this one.
Yeah, it's hard. I mean, like, I feel like it's just when you have really like a complex health situation, it's this really long-term project.
It is, yeah, and it never stops either. It's not like I guess there was part of me that thought like, oh, okay, so I'll get a diagnosis and then we can treat the problem.
Yeah,
and
exactly. It just doesn't work that way.
Yeah, I never really expected to like get better, but I did it. I think I was expecting that. Having a diagnosis would point me in a direction where, to some extent, it did do this. It pointed me in a direction and was able to kind of like better hone what I was focusing on and trying to treat, secondarily. But man, it is an ongoing battle. And it's been a lot like whack-a-mole,
Yeah,
just
exactly.
fixing one problem or maybe like alleviating one problem. And then like when I started getting I get Botox for chronic headaches, and it's been remarkably successful for the most part, but I still have a headache every day. But it's a lot better. But once I turned the volume down on the headache
Yeah.
thing was when I realized I had musculoskeletal pain. Like I knew my body hurt, but I didn't know how much until the head pain wasn't so distracting.
Yeah, exactly. It's like you can't even see what the other things are when one thing is just so bad.
Yeah.
Like that's all you want to fix.
Yeah, and it just overwhelmed my senses, like, and especially something like head pain, which is so kind of central to your perception. I don't think I would have gotten diagnosed with EDS if I hadn't started the Botox treatments, because I wouldn't have thought to even like focus on my body pain.
Yeah.
So that was an interesting learning experience where I was like, oh shit, this is a lot more complicated than I thought it was, wasn't it?
Yeah. I think too, I don't know if you find this, but like I feel like sometimes the doctors also think we expect to be completely fixed.
Yes. Oh my God. I have to say that I say that to new doctors when I see them. I have to be like, listen, all right, I know the deal. Like, this is not getting better anytime soon. It's
Yeah, like
probably not going to get better at all. I'm not expecting that from you. Let's just try and figure out what it is first, and we'll take it from there.
yeah, figure out what it is maybe like and like a modest goal like a 25% improvement would
Mm-hmm.
make such a difference in my life.
Yeah.
Like, can we work towards that?
Yeah. Yeah. I think, and the way that they're taught is to, focus on finding solutions. But I think, our job as patients, maybe at least in trying to do our part to train physicians, is maybe just remind them that instead of like focusing on solutions, maybe you should focus on like your goals and your priorities, which, in my case is a quality of life. And that's really different than, most people my age who would say like, I want to get rid of this knee pain. Like
Yeah.
getting rid of my knee pain is like a hilarious concept. And
Yeah.
I'm
You
like,
don't even think
whatever.
about that, right?
Yeah,
It's
no,
like,
I
oh
would
no,
like,
I'm in it for life with the knee pain. Okay, that's fine.
yeah, exactly. And like, how can we work together to make the quality of my life better? That's what my priority is. I don't need you to fix me, you know?
Definitely. I so wish that like there was good ways to get that sort of message through to doctors too. Like we
Right.
never get a chance to talk to them about this stuff.
Yeah. Well, yeah. I mean, if you only have 7 minutes or 15 minutes or whatever the case may be, most of the time, you're just not going to get an opportunity to talk about anything more than exactly what the task at hand is, which is really unfortunate. And I don't have any solutions. Like, obviously, it's not really working anywhere,
Yeah.
under any circumstances. And maybe it is. And if the listeners know of any place that this is actually happening, please let us know. That doesn't mean that you should give up and stop working towards those goals. But it's hard, and it makes it, at least for me as a patient and a patient advocate, it's hard for me not to burn out.
I spent most of the year, especially I was really, really sick with my GI stuff in the summer, and like, I should write up some complaint letters, and I should probably write some more blog posts, but at some point, it's like you can only do so much of this.
Yeah.
You have to put the main energy into actually making it to your appointments and
Right. Or
taking care
even
of
just
yourself.
getting out of bed, like
Or getting
just
to bed.
feeding yourself and, getting to the
Yeah.
bathroom on time.
It's
Like,
one of the things where I wish that, and this comes back to this like bigger societal thing, but like you see a lot of fundraising and awareness raising that like family members and businesses and stuff do for some illnesses,
hmm
and you just don't see it for like complex chronic
oh, of
illness.
course not. Oh, no. Well,
And
I
it's like
mean,
we're the people who actually would really could really use the help
Yeah.
doing that
Yeah,
because
absolutely.
we're not really able to do a lot of advocacy for ourselves and not really like,
Right.
you know, what do you call it, like groundwork or like you're really attending things and
Yeah. Showing up to stuff on a certain
yeah.
day at a certain time. Like that's
And it's
not,
like if our families even understand this, like to
yeah.
help us advocate about it, it's
Yeah, it really rolls into the larger thing about stigma and I just don't think that like we have the cultural capacity to like deal with complexity
yeah.
in general. So, if you apply that to something that's already pretty heavily stigmatized, it really makes the waters pretty murky for as far as like campaigning and like getting people to understand things about it.
Yeah. That pretty much nails it, doesn't it?
It does. It does.
Yeah, kind of coming back to the end of it and just how to go forward living with this, like
Mm-hmm.
the uncertainty about ever getting diagnosis or treatment that really helps. Like I'm really coming back to focusing on like what things can I do that are going to make my day-to-day life better long term.
Yeah.
And some of those things I'm sort of starting to figure out, and like others I'm still really just beginning, like the whole thing about how to get back out in the world again,
Yeah.
how to socialize,
Oh,
like
that's a big one
reconnect
because
with my family because like really the last 3 years have been a massive strain on my like family relationships, also like not my spouse but other
yeah,
ones.
mine too.
It's like I feel like I've figured out a lot, and I've been doing this for so long now, but like there's still a lot to figure out. And I'm also the whole aging thing. Like,
Yeah, that
you want to
doesn't
get
help.
ahead of this before you start getting too much older. And then also at a certain point in your life, these are the years we're supposed to be getting our careers on track, like in the capitalist society paradigm, or having kids. And it's like, I don't feel like there's a lot of support trying to figure out what's realistic with that sort of stuff. Like,
Hmm.
what kind of life plans are reasonable to try and work towards.
Right.
And
Let
so
alone
it's
figuring out
heavy
like
on
what
my
do you
mind.
actually want, like
That I was
that's
talking
pretty
with someone
important.
about that recently. A friend of mine who's also been sick, and like, I never even get to thinking about what I want. Like,
Yeah.
I've only just begun to sort of think about that again because it's always just coping,
Yeah.
like taking care of the basic necessities, trying not to let things go downhill that haven't yet. There's not a lot of space for like, do I want kids? What kind of job do I want? Like, do
Right.
I get to even think about that? Is that just a luxury and a privilege I don't have access to anymore?
Yeah. That's a that is a great way to phrase that question. Because I don't think, these are not things that we are told to expect to have to worry about, and most people don't ever have to worry about that. I consider myself really lucky because I just never wanted kids. So that kind of makes it a lot easier on me because I'm like, well, I mean, that solves that problem, you know?
Yeah, I mean, I feel like I'm lucky that I wasn't like really, really wanting to. Like,
Yeah,
it's definitely been a topic of conversation that keeps coming up. Like, should we, could we? But yeah, I mean, when you can barely manage your own needs,
right.
and especially if you don't have like a load of family support around you,
Hmm.
like nearby, yeah, it's hard to even think of doing something like that.
Yeah. Motherhood would probably murder me. I think I
I feel the
would
same
probably
way.
die.
It's scary for sure.
Yeah.
Yeah, and like, who do you talk to about that? You
Yeah.
know, my GP's not really going to have that conversation with me.
No, and nor would they have the time, right?
Yeah.
I mean, and this brings up a whole other conversation about access to mental health care and whatever, but that's a whole other thing.
Hmm.
But, counseling can help you if not figure out that specific question, but just kind of get to know yourself better and learn more about what you do want for your life and evaluate, what kind of things are reasonable. Like, just because we're disabled doesn't mean we can't want things, or have goals
Yeah,
or
absolutely. Yeah,
whatever.
I mean, I did a ton of counseling, honestly,
Yeah.
and like, I think it helped strip away a lot of the like crap I was worrying myself and like sort of distracting myself with,
Yeah.
which
Because a lot
helps.
of that stuff, I'm sure, was probably you comparing yourself to other people.
Absolutely,
Yeah.
exactly. This whole like learned behavior of trying to keep up with peers, pressure to achieve,
Right.
whether it be like career, academics, or things like that. And I had to work my way out of that because it's just not
Yeah.
useful. It's
No,
not
it's
useful
not
to
at
me.
all. Every once in a while, I'll find myself getting like I'll be on Facebook or whatever, and like everyone's getting married and having these like really cute babies, and I'm like, I start feeling bad about my life, and then I'm like, I don't even want these things. Why am I feeling these weird pangs of like jealousy and like feel like I'm missing out when like I don't want to have kids, I don't want to get married, and yet here I am comparing myself and my life, which, like has its problems, but I think I'm doing okay. Like I'm okay with where I am in my life.
Yeah, I mean, you're like accepting it, right?
Yeah, I'm trying to. And also, the other thing that we have to constantly remind ourselves of in the age of social media is that you are getting curated versions of people's lives. Like they are not posting about the fights, the constant fights that they're getting in with their, picture perfect spouse or whatever. Everybody has problems. People have problems, and life is not a curated Instagram feed all of the time. It's
Yeah,
rarely
it's
that.
true.
It's so rarely that.
Although I also was thinking like, I've told myself a lot that like I don't want kids or like I don't care about having a career that much. Like I just want to feel okay and be happy enough. And
Hmm.
I think like some of that is really true and it's part of me accepting the reality of my situation. But
Yeah.
then like I think sometimes that I also convince myself of that because I know that some of those things aren't an
Yeah.
option.
And you can totally feel both ways at the same time.
Yeah,
Like
totally.
it's okay. Like people can have more than one feeling or idea about something at the same time. It's not gonna like tear a hole in the space-time continuum. And I think we're just always kind of conditioned to, well, I mean, there's just the whole, grow up, get married, have a baby, thing. And then
Yeah.
there's, the social media makes it so much worse just because we are seeing these, meticulously curated versions of maybe 2% of people's lives.
Yeah, and I like personally, I'm big on like real social media posts.
Mm-hmm.
I know that's like not everyone's cup of tea, but
Uh,
have to say that as much as some parts of social media suck, I really do love how it enables people like us to like find each other
mm-hmm. For sure.
because
Yeah.
really like the subsets of communities you can find your way into, like I've met all these people who like sew or knit or do art and are also disabled or chronically ill. And I'm like, my people, and people can say what they want about online friendships being like less real, but like, I might not hear from a lot of my real life,
Yeah.
like physical world friends a lot of the time. They might really not understand what's going on with all of this. And it's those people who I've met online who are living the same kind of life who are the ones who, check in or like
Mm-hmm.
really can sense when things are off with me. And I'm really grateful for them.
Yeah. Yeah, that's a really good point too. There's so much wonderful and so much terrible on the internet. It's a matter of like navigating and finding your way to your tribe.
Truly.
Yeah. Well, that seems like a good place to stop.
Totally. Before we both lose our voices.
Yeah.
No, I'm going to not talk all weekend.
So thank you for listening to In Sickness and in Health. Check out the show notes for links to some of the stuff we talk about in this episode, including a link to Ariane's project, Textilia. Subscribe and stay tuned for everything we have to come. And check out our dysautonomia series from our first week. Let us know what you like about the show so far. Please rate and review us on iTunes. It helps other people find the show. And tell your family, tell your friends, tell your doctors. But most importantly, don't forget to be excellent to yourselves and each other.